Now to the very latest on this COVID surge, Arizona adding almost 2,000 new COVID cases, along with 162 COVID-related deaths. According to our data analyst, Garrett Archer, hospitalizations continue to slow. There's an 8% decrease in inpatient COVID-19 bed usage and a 13% decrease in ICU bed usage from just last week. But our state's largest hospital system says this COVID surge is not slowing down anytime soon, and they do need our help. Banner Health confirms some of its hospitals are currently operating at above 100%. Almost half the people in its ICUs are COVID patients. ABC 15's Amelia Fabiano found out what it's like on the front lines and what those doctors and nurses are asking of you.
Banner Health pleading with the public. The time to get vaccinated or boosted is now. Chief Clinical Officer Dr. Marjorie Bessel saying in a press conference, this surge won't peak until mid-January.
Currently, COVID patients account for 40% of our ICU patients. Nearly 90% of those COVID ICU patients are unvaccinated.
I spoke with an ER nurse at another major hospital network in the Phoenix area who asked to remain anonymous. He tells me they're seeing the same thing over and over.
The majority of the cases that we're seeing are all unvaccinated people.
While they're trying their best, he says it's difficult to balance both COVID and non-COVID patients because of the amount of time COVID patients require.
That patient population takes a lot of work, and being short on nurses and physicians, it obviously puts a burden on the hospital systems here in the Phoenix area.
And a burden on those working in them.
It's a mental drain.
Both nurses and doctors urging you to avoid large groups this New Year's weekend and do what the science shows can help keep you out of the emergency room.
Our workforce is very tired. Many of them had to forego their celebrations and holidays so that they could be there to take care of our very sick patients. I would ask everybody out there to think about that 2 years in and do your part. Get vaccinated, get boosted, wear a mask when you're indoors, don't go out when you're ill, and if you're having symptoms, get tested.
Amelia Fabiano, ABC 15, Arizona.
Amelia, thank you. Top Banner Health officials also urging you to consider going to your primary care doctor or urgent care for medical help. They say only go to that emergency room if you're experiencing life-threatening symptoms like uncontrollable bleeding, trouble breathing, sudden or severe pain, especially in the chest or stomach pain, or confusion or changes in your mental state.